Hello, everyone, and thank you for tuning into IFFGD's new series titled Research Award Winners, Where Are They Now? This program was actually designed to not only recognize this year as being IFFGD's 30th anniversary, but to also give us the time to catch up with some of our past Research Award winners. Today, we have the pleasure of speaking with Dr. Di Lorenzo, who is actually our 2013 Research Award winner for Senior Investigator in Pediatrics. Thank you so much for joining us today, Dr. Di Lorenzo.
Oh, thank you for having me. I have a lot of fond memories of IFFGD. So happy to be here.
Awesome. So, can you actually please share with us just a little bit about yourself and your current career focus?
All right. I was born and raised in Italy, in the south of Italy. Went to the University of Medicine in Naples, Italy. And then I moved to the United States after medical school, after I completed my training in pediatric and pediatric GI. And I spent the first few years in the US in Los Angeles, and then I went to Pittsburgh. And then for the last 16 years, I've been here in Columbus, Ohio. And currently, I am a division chief for one of the largest GI divisions in Children's Hospital here in Columbus, and I'm a professor of pediatrics at the Ohio State University.
Yes, at the Ohio State. Thank you so much for sharing that with us.
Sure.
So, since winning the IFFGD Research Award, what are some of your current research topics that you're focusing on today?
So my research focus has always been clinical. So I've not done most of my career has been on dealing with diagnosis and treatment of children with functional GI disorders. Currently, we have some epidemiologic study looking at the effect of COVID on children with functional abdominal pain and irritable bowel. Then we have some pathophysiologic studies looking at the effect of different medications or interventions on colonic motility. And then we actually have a very strong focus in our division on gastric pacing, on pacing of the GI tract, both gastric and sacral nerve stimulation, and even tibial nerve stimulation in an attempt to help children with a variety of functional disorders. So epidemiology, diagnosis, and treatment of children.
Oh, that is awesome. And how do you feel maybe winning the IFFGD Research Award may have influenced your career?
To be honest, I received it when I was already senior investigator, so I was already a little bit on the stage where I already had established my research interest and my research productivity. But it's always incredibly rewarding to see your work being validated. I think the hospital here obviously appreciated very much knowing that I had received such an award. Is always good for marketing, and it's always good to give me some credit with the younger fellows and junior faculty. So, and to be honest, also the fairly significant funding that came with that helped supporting some of the research activities. So, you know, it was a very much appreciated award.
Yeah. Yeah, and it's just always nice to know that the award was able to help you with other and further other research studies in your lab.
Very
Um,
much.
yeah, and knowing some of the research studies that you are involved in, I know you mentioned a little bit how some of them are focused on bettering treatment options. But can you tell us more about what you hope to gain from some of your research studies and what these studies can help us understand about gastrointestinal disorders in children?
So a lot of our studies look at the connection between brain and gut and how these disorders are generated by the dysregulation of brain and GI tract interactions. The goal is always the same, to improve the quality of life of the children with functional disorders or with motility disorders, and to be honest, the quality of life for the family in general, because we have quite a bit of focus not only on the child itself, but also the effect of the child's disorders on the family dynamics and well-being. We have a variety of multidisciplinary teams. I'm particularly proud of what we're doing with adolescents with a condition called rumination syndrome, which is a condition in which adolescents usually have troubles in keeping down all the food that they eat. And we have, I think, probably the only rehab place in the United States for individuals with rumination. So we try to come up with better strategies to make children feel better.
Yeah, and I think you actually touched on a really good point there where you not only say you're looking for better strategies to help the children feel better, but also just to kind of help the parents and caregivers with treating and helping their kids get better. And all of the research studies that you are involved in, and like you mentioned, you were awarded the Senior Investigator Award. What would you consider being your most successful research study and why?
That's a good question. Maybe we were maybe we're the first to show that children with irritable bowel had visceral hyperalgesia, very sensitive GI tract. We use a specialized balloon called barostat to test the sensation of the GI tract. I think that was important to show that it's not all in the head, that there is a true physiologic abnormality. I'm very proud of my work on colonic function and colonic manometry, which we really pioneered in pediatrics. And the work on rumination actually is one of the biggest satisfying endeavors of my career. Having children that come in, not be able to keep down even a grain of rice or Cheerio, and leaving after 7 days, being able to eat a lasagna at the Cheesecake Factory has been really a particularly satisfactory endeavor. So maybe those, and I publish a lot of papers, but those are the ones that come to mind right now.
Yeah, and I can only imagine how rewarding that is to see your patients get better, especially after coming in with such a major impact on their quality of life. So what other acknowledgements have you received in your career as a researcher?
I was lucky that I was elected president of the North American Pediatric GI Society, so president of all the pediatric gastroenterologists in North America. I was the first immigrant that received such a prestigious award or election. So that was actually a lot of fun. And then I received also the AGA Master Clinician Award. That was also very nice because pediatricians do not often receive the attention that our adult colleagues receive. And in fact, I have to be honest, IFFGD has been one of the very few society that even though the lion's share of membership and program is about adults, but it pays a lot of attention to Peace GI, and they even awarded a research grant to me and my group in the past to try to build a multi-center research consortium. So IFFGD, chapeau to their attention to children as well.
Thank you so much. Thank you so much for just that brief acknowledgement there. And, we just love working with doctors like yourself so that we can help the patient community and especially the pediatric community. So we have you to thank as well for all of your hard work in helping to advance the field.
Thank you.
What specifically do you enjoy about being a researcher?
I think it keeps you intellectually satisfied. It's always fun to ask good questions, try to uncover new mechanisms or new treatments. And at this stage of my career is also particularly rewarding to work and mentor younger investigators and kind of help them, help their career take off. And the other very rewarding aspect of being a researcher is the interaction with peers and the collaboration with peers around the country and around the world. I've established friendships that go beyond just work with people like Miguel Saps or Mark Beninga, other people that have received IFFGD awards in the past, and I consider them among my best friends. We help each other with research, we help each other with taking care of the most complicated and challenging patients. Makes it worth going to meetings and because you meet them, and there is actually in pediatric GI a lot of camaraderie, especially in the functional and motility group that has been really a particularly rewarding aspect of being a researcher. But those are the big ones, asking questions and getting some answer, mentor young investigators, establish across the board collaborations and friendships.
Yeah, and I mean, I'm pretty sure just having you as a mentor and furthering the future of research in this area is a tremendous impact, especially where you are at the Ohio State. So, when we're talking about research, I think many of us know that there is a lot of gaps in understanding GI disorders. What do you feel might be more specifically some of the gap needs in research, and how do you expect for your research lab to fulfill some of those gap needs?
For me, that I'm a pediatrician, I think one of the biggest gaps is always the fact that children tend to be a little bit left out of most of the treatment studies. The FDA usually starts always studies in adults, and medications get approved without any testing in children. So that remains a big gap. We have plenty of medications, for example, that are approved by the FDA for treatment of adults with IBS, and we have zero approved for use in children with functional abdominal pain or IBS. So that's a huge gap. Makes it difficult to have insurance coverage for some of those medications because they are used off-label. It makes it difficult for us to figure out the dose and then the how to use this medication, the type of patients selection to use. So that's a huge gap. The other big gaps is always, to me, a little bit the stigma that comes with many of the functional GI disorders. How do you get the general public to accept the role of emotions and stress on the GI function, especially now that we are in the middle of an anxiety epidemic? There is so much stress on children and so much anxiety. That still there is a little bit of stigma there. And then, still try to understand the pathophysiology, why some children get better, why other children don't get better, why some children develop disabling symptoms, other children develop milder symptoms. So what's underlying the different clinical course of the different patients. So unfortunately, there are still a lot of gaps. I believe we are in a better place than 31 years ago when I began to do to take care of children with motility and functional GI disorders. So I think we have made some progress, but obviously we're not quite there yet. I think there is a lot to be done and to be learned.
Yeah, and I really think that what you touched on as far as everything, the whole being of what it surrounds to live with a chronic GI disorder, it can be extremely debilitating, and it can have an impact on the individual, but also the family. And we just am extremely grateful to have researchers and doctors like yourself in the field who are passionate about learning more about these GI conditions, but also how to fulfill some of these gap needs that you talked about.
Yeah, I mean, this morning I saw a girl from Michigan that The entire family life has been falling apart. Just focus on her inability to have a bowel movement, which seems like, in the big scheme of things, not a huge problem. But if it is a daily problem for months and years, then takes a tremendous toll on family, on the child's self-esteem, on the child's ability to interact with peers, and and so sometimes people think, this is just irritable bowel, it's just constipation, it's just reflux. No, I mean, yes, you don't die from it, but your quality of life can be dramatically affected by it. So,
Yes, and that's why we must continue to raise awareness
yeah,
and just continue to help educate the general public about the impacts of these disorders for sure.
we'll keep doing it as long as they let me do research, and as long as I'm not retired, we'll keep working.
Well, thank you so much for all of your hard work in the field. And thank you, everyone who has tuned into IFFGD's Research Award series titled Where Are They Now? Where today we've had the pleasure of catching up with Dr. Di Lorenzo, our 2013 Research Award winner. So thank you, Dr. Di Lorenzo, for providing us your time and a little insight in your journey of research.
My pleasure. Thank you for having me.